This is Robert Motzer. I'm a medical oncologist at Memorial Sloan-Kettering Cancer Center, and I am the lead investigator for the phase 3 trial of tivozanib versus sorafenib in first targeted therapy for patients with metastatic renal cancer. This was an open-label, randomized phase 3 trial that compared tivozanib as the new experimental drug to sorafenib as a standard treatment in patients with metastatic kidney cancer receiving their first targeted therapy. The trial accrued more than 500 patients, and the primary endpoint of the trial was progression-free survival. The eligibility criteria included patients that had only clear cell cancer, which is the common type of kidney cancer, and with regard to prior treatment, they could not have received a prior targeted agent like sorafenib or sunitinib. They were allowed to have cytokine treatments such as interferon. More than 500 patients were randomized, and the trial met its primary endpoint. The median progression-free survival for patients treated with tivozanib was 11.9 months, compared to 9.3 months with sorafenib. Most of the patients were treatment naive, and that's really where we think the tivozanib fits into this schema for treatment of kidney cancer. And in that proportion of patients, the median progression-free survival was 12.7 months compared to 9.1 months with sorafenib. With regard to the safety profile, one of the most attractive features of tivozanib is its favorable safety profile. There were very few patients that required dose reductions or interruptions or came off study for toxicity with tivozanib. And the predominant side effect of tivozanib is hypertension. Many of the side effects that are troublesome to patients, including skin toxicity, diarrhea, nausea, fatigue, occur very uncommonly with tivozanib, and that makes it one of a very attractive feature for first-line therapy. At this meeting, we presented the results of the final overall survival analysis, and in that, the median overall survival for tivozanib was 28.8 months, compared to 29.3 months with sorafenib. There was no statistical difference between the two. The reason why the overall survival was slightly longer in the sorafenib arm was because there was a crossover built in, where the patients who were assigned to sorafenib were crossed over to tivozanib when they progressed. There was no statistical significant difference between survival in the two arms. And in my own opinion, the takeaway point is that the survival is increasing, and it's increasing quite dramatically in patients with renal cell cancer with these new targeted agents. The median survival before we had these agents was only about 12 months. And so this is a landmark study, in that the median survival is pushed out over 28 months. I also think it provides a good example of the fact that more agents are better for the patients. We give them in sequence, and so the more agents that are available that can be used for patients, the better for the patient, the longer the survival.